I'm Susan Hunt. Join me for My Health Counts. Colorectal cancer screening saves lives. It's one of those subjects nobody likes to talk about. Of cancers that affect both men and women, colorectal cancer is the second leading cancer killer in the United States. But it doesn't have to be. We'll show you how to take control of your health and reduce your risks. Colorectal cancer screening saves lives.
You don't talk about these things. You know, ladies don't talk about bathroom habits. I knew what a colon was, but I didn't know about no colon cancer or to have this test done at a certain age. I was 51 at the time, just lost my job, didn't have no insurance.
Betty is exactly the type of person that we like to enroll in our program because she could have very easily have fallen through the cracks. She didn't think there were any services out there for her, and once she came to us, we were able to provide her with all the necessary screening tests, breast, cervical, and colorectal.
So they sent me something in the mail. You had to send it back with some stew on it. When I first got the results back, really I didn't believe it. I felt fine. I would never have thought anything was going on in my body. I just thought they made a mistake. That's what it was. They made a mistake.
I told her her test had come back positive, and it could be something as simple as hemorrhoids or diverticulitis, but it could be an early sign of colon cancer. And that the next step for her would be a colonoscopy, and we were going to be referring her to a specialist, and then our program would pay for it.
Doctors usually scare me, but she was gentle and she talked to me and she let me know that they found something that they're not able to remove. It was nothing to be alarmed about, but she did want to do the surgery. Dr. Dunn's associate, he came in and he talked to me and he said, we just got the results back. He said, I got good news and bad news. I said, well, give me the bad news first. He said, well, we had to remove half of your colon. I said, well, then what's the good news? He said, but it wasn't cancerous. I thought it happened to everybody else but me, or somebody I know, and now I know it can happen to you. So that's why we have to get it tested. We have to be tested.
Let's talk about what tests are out there, and I want to start with one that is pretty well known, and that's just a basic stool sample.
Right, so this is a test that's usually administered at home, and the purpose of this test is to detect microscopic amounts of blood in the stool, which the majority of times is something benign and not related to cancer, but if there is microscopic amounts of blood in the stool, that can be a sign of colon cancer and should prompt some additional testing.
Mm-hmm. Now, is that a test that somebody should have like once a year, once every 5 years?
Usually the recommendations are in patients over the age of 50, they should have that administered every year.
Mm-hmm. Now, I've heard of a procedure called the sigmoidoscopy, and I'm sure you've performed a number of those. Let's talk about how that procedure works.
So sigmoidoscopy looks at the lower third of the large intestine, and what that test involves is basically a tube that has a light and a camera on the end of it being passed into the rectum and passed up the left side of the large intestine. It only looks at the lower 1/3 of the bowel, but 60% of polyps and colon cancers typically develop in the left colon, so that test is a good test. It is a little bit less invasive than a colonoscopy. It typically does not require sedation to do, and that test is recommended every 5 years, assuming the first one is negative.
You know, you mentioned the colonoscopy. That's often referred to as the gold standard of testing. Why is that?
Well, the colonoscopy looks at the entire large intestine and not just the lower 1/3 of the colon. And for that test, you're a person sedated for it, so they really don't remember much of the test. They don't feel much pain or cramping or bloating during the procedure. But that test allows us to look at the entire large intestine, and if we find any polyps at the time of that procedure, those polyps are typically removed, which is what can prevent a person from developing colon cancer in the future.